Welcome. Today we are going to discuss autonomic dysreflexia, or what is commonly referred to as AD. You should expect this presentation to last for about 15 minutes. This presentation includes loud noises. By the end of this presentation, we want to make sure you know what AD is, how to prevent it, the symptoms, what to do if an AD episode happens, and what to do if you cannot get it to resolve. This is Sam, our augmented reality assistant. He will be helping us to learn about AD today by bringing education to life. AD can occur in anyone with an injury at the 6th thoracic spinal nerve or above, like Sam. Any irritation at or below the injury can cause AD, followed by a potentially dangerous rise in blood pressure. Blood pressure is the pressure created in your vessels when your heart beats. Big changes in blood pressure can be concerning, so monitoring it can help keep you safe. This is Sam's nervous system. Before Sam's injury, nerve communication would travel through the brain, spine, and nerves uninterrupted. Our nerves communicate a lot like electric cables, so damage can interrupt the signal. After Sam's injury, nerve signals do not reach every part of the body. Nerves control all parts of the body, including blood vessels. When there is an irritation at or below the injury, blood vessels can become narrower and may cause a rise in blood pressure. Typically, your body will try to lower blood pressure by widening blood vessels using nerve signals above the injury. However, these signals cannot reach the vessels below the injury to compensate. This inability to automatically compensate creates an uncontrolled rise in blood pressure. There are several signs and symptoms of AD. Most commonly, AD can present itself as a sudden, pounding headache. Some people may also experience changes in vision, such as blurred vision or spots in vision. Your heart rate will likely slow down, and you may notice changes in your skin above your injury, such as goosebumps, sweating, or flushed skin. Some people experience a sudden nasal stuffiness, ringing in the ears, or new feelings of anxiety. If your blood pressure continues to rise, you are at high risk for seizure, stroke, or in extreme circumstances, death. The most common causes of AD are the bladder being too full, constipation or complications during bowel care, infections, especially urinary tract infections, pressure wounds, poor position, or tight clothing. Other possible causes of AD may come from irritation below the injury, extreme temperatures, spasticity, or even orgasm. The first thing you can do if you are experiencing any AD symptoms is sit up and check for easy and obvious causes. If you're uncertain this is AD, measure your blood pressure to confirm. Begin searching for the cause. Depending on the cause, you can empty your bladder, clear kinks in your indwelling catheter if present, empty your bowels, treat the infection, address any wounds, reposition to relieve seating pressure or lessen spasticity, loosen any tight clothing, remove the irritant, find a more comfortable temperature, or wait for the orgasm to pass. Once the cause of the AD is identified and resolved, your blood pressure should return to normal within minutes. For some people, AD occurs often and is usually managed at home without help from a doctor. Others experience it less often, but still manage the episode at home as long as they are very familiar with what to do. In rare circumstances, AD episodes are severe. This occurs when the cause of AD cannot be identified and symptoms continue to escalate. In these cases, it's important to seek medical attention. You should get in touch with your primary rehab provider immediately. If this is not possible, call 911. AD is largely preventable. We recommend that you follow your bowel and bladder routine. Ensure you are doing frequent position changes. Wear comfortable, loose-fitting clothing. And adjust clothing after a transfer. Pack appropriate clothing and equipment when going out. If you wear an abdominal binder or compression socks, make sure that they are not too tight. Educate your family and friends on AD so that they will know how to identify and assist if an AD episode happens. Consider carrying the AD card from the Yes You Can manual in your wallet or bag, along with a portable blood pressure cuff. In summary, AD is a medical emergency and can be life-threatening if not resolved. There are many possible causes of AD. Any irritation below your injury can potentially cause AD if your spinal cord injury is at or above T6. Although AD can be scary, it is your body's way of alerting you of an underlying problem that you might not feel. It is important to understand how AD can affect your body, recognize symptoms, and know what to do in a timely manner. Once you identify and resolve the cause of AD, your blood pressure should return to normal within minutes. We hope you found this information helpful. Please direct any questions to your healthcare provider. Please take a minute to answer the following questions and reach out if you have any additional questions or comments regarding AD or Learning with Sam. Thank you.